Thank you, Mr. President. Good morning, colleagues. Good morning, Nebraskans. I'm excited this morning to introduce this bill because I didn't know if I would end up in this place again after last year. And I've had so many great conversations with so many of you. I've done my best to talk to all of you about this bill. You've seen me buzzing around in the last few days. And I'm excited to kind of bring it into prime time here. LB307 is my priority bill. It was my priority bill last year as well. And what it does is it removes an existing statutory barrier to allow for the potential creation of syringe service programs in Nebraska. I'd like to thank Speaker Arch for being a great partner on this. And, we've worked through a lot of questions that he has and talked about a possible amendment on select to address some of his concerns and different clarifying things that we can do. And I've done my best to talk to all of you. I've got a good card here. I know I didn't get a chance to talk to everybody, but the truth is it takes a lot out of me. And so I will tell you that I did my best. We also have a lot of great letters of support here from the former Indiana Health Commissioner under Governor Mike Pence, U.S. Surgeon General under President Trump, from the Nebraska Pharmacists Association, and from Sergeant Aaron Hansen, who is the sheriff in Douglas County. LB307 would allow local jurisdictions, so it would have to be approved by a city council or a county board or a village board, to authorize public behavioral health programs to distribute hypodermic needles or sterile syringes as part of public health efforts to reduce the spread of infectious disease such as HIV and hepatitis C. These syringe service programs, I'll refer to them as SSPs, they are primarily used as a place for people to get referrals to substance use disorder treatment programs, screening, care for viral hepatitis, HIV, STIs, overdose prevention, safer injection practice education, and supplies to help them prevent overdoses. In Nebraska, especially in rural Nebraska, we have a really serious increasing problem with the use of Narcan, with the use of fentanyl, and we've seen an increase in opioid overdoses in our rural parts of the state. And this bill, with a lot of broad support, is something that we know is going to help with that. These SSPs can also provide vaccinations for diseases like hepatitis A and B, wound care, and referrals to social, mental health, primary care, and other medical services. In most cases, those medical services can be provided right at the site as well. When a person steps into an SSP, they build trusting, non-judgmental relationships with clinic providers, staff. Often, many of these staffers and clinic providers are people who have experienced addiction themselves. And they get the care they need to get to a better place where they can think about seeking treatment. We know that people who access these services are 5 to 10 times more likely to seek treatment, to kick addiction, and we know that in the rural parts of our state where access to health care can be limited, this would give counties the opportunity to kind of expand the resources that they have for these kinds of treatments. SSPs also offer benefits not just to the participants that utilize their services. Even if you're not an addict, even if you're not going in to use these services, this can still benefit you and your communities and your districts. Studies show that these SSPs reduce litter, and they reduce the likelihood of unsafe, used needles ending up in places like parks and playgrounds. A lot of people also fear the legal risk of carrying used syringes due to existing paraphernalia laws. And because of that, they're more likely to dump them somewhere that's more risky to the public. This bill would also protect first responders and law enforcement from needle stick injuries. And it'll protect communities from potentially dangerous infectious disease outbreaks. We know that this lowers the infectious disease spread, specifically HIV and hepatitis C, by 50%. When advocates approached me about bringing this bill, I was surprised to learn that in recent years, Nebraska's HIV infection rate shot up to its highest in over a decade. In the 3-year period from 2018 to 2021, while the United States as a whole experienced about a 5% decrease in new HIV diagnoses, Nebraska saw a 26% increase. Rural areas were hit hardest. New cases in rural areas, Buffalo, Hall County, they doubled in 2021. And Buffalo and Hall County currently have the highest HIV infection rates in our state. There's some speculation that something happened, between 2020 and 2021 with the pandemic isolation that could have contributed to this, but we don't know for sure, and it doesn't explain why the rest of the country, all those rates went down so dramatically, but in our state they went up so much. And it shows why we need a bill like LB307 and the services that it's going to bring to our state. There's only a few states that don't have these programs authorized. In Nebraska, this is currently not authorized. An organization couldn't do this if they wanted to. They need this bill to pass so that that can be possible for them. I want to talk also about the opioid problem in Nebraska and how SSPs can help address that in a data-backed, non-punitive way that will not result in increased incarceration for the people who are facing addiction in our state. We all know about the recent rise in our state of fentanyl use and overdoses. It's an extremely powerful opioid that can be lethal at a very, very small dose. Overdose-related deaths from fentanyl in Nebraska have steadily increased across the last decade. Over the last decade, they've increased by 176%. 229 Nebraskans died of overdose in 2022 from fentanyl. And data collected from our 19 local health departments show that opioid misuse is trending upwards in 9 of those, led by the Dakota County Health Department region. The Federal Behavior Risk Factor Surveillance System survey, grouping Nebraska's counties into 3 categories of large urban, small urban, and rural, shows that opioid misuse in the state is highest in the small urban counties. With LB307, we are simply removing the barrier at the state level so that cities, villages, and counties that might want to consider adopting an SSP, they don't have to do it. We're being asked to do this by a lot of cities around our state. But if they want to do it, LB307 will give them the ability to do that. It would be up to the approving locality to determine the parameters of its own program. That would include stuff like who they want to administer it, if it's the public health department, if it's a behavioral health clinic, if it's a hospital or a federally qualified health center, what their funding source will be, and any other ordinance they might want to pass to govern the SSPs. That would be up to them. So what I'm saying is, for example, in Omaha, where I represent, our city council would have to pass, they would have to pass something that would allow an SSP to be created. And then an organization like the Nebraska AIDS Project or Charles Drew Health Center or another federally qualified healthcare program would put this in place. And it gives power to those programs and the expert medical providers in those programs to determine the standard of care. All of these people will be following the standard of care. And then we will be joining the 45 other states that have operational SSPs who listen to public health and medical experts and let those cities or county give this the shot that they want to. We've had a lot of wide support on this. I'm very excited about it, to have the support of the sheriff, to have the support of Dr. Ali Khan, of a broad range of bipartisan support. I can tell you guys there's no tricks with this bill. I'm just excited to do something good that's going to help a lot of people facing addiction in Nebraska, that will bring Nebraska's standard of care and the health care that we're able to provide to our constituents up to a level that they can get in other parts of the country that they ought to be able to access here too. I'm happy to answer any questions. I'm kind of going through my notes here. I think that's sort of the long and short of it. But if you have questions, I'd be happy to answer them. And with that, I'll yield the remainder of my time. Thank you, Mr. President.
Senator Hunt, you're recognized to close on LB 307.
Thank you, Mr. President. Colleagues, thank you so much. That was really nice. That made me feel good, and not just what was said on the mic, but a lot of the side conversations that I had. People who I've had tension and strife with in the past, asking to co-sponsor, people with very thoughtful questions that, instead of just voting no, you brought your questions to me and we resolved them, and that's really what we were sent here to do. That's what the work of lawmaking is about. That's statesmanship, and it makes me very proud to serve with all of you and to be working on things that we know is going to improve the lives of Nebraskans, reduce suffering, help people who experience marginalization, and also keep our first responders and communities clean and safe. So thank you for that supportive vote. I urge your green vote on LB 307, and thank you very much. Thank you, Mr. President.
Thank you, Senator Hunt. Members, the question is the advancement of LB 307 to E&R initial. All those in favor vote aye. All those opposed vote nay. Record, Mr. Clerk.
37 ayes, 2 nays, Mr. President, on advancement of the bill.
LB 307 advances to E&R initial.